Now, Eswatini's health ministry has released the latest COVID-19 figures in that country. In total, 13,187 confirmed cases have been recorded. There have also been 8 new deaths, bringing reported deaths to 384 people that have died of COVID-19 in the kingdom. Now, the landlocked country is currently experiencing an increase in infections, and citizens have been warned to follow strict health protocols. Let's get you the latest on the story. We're joined now by Senator Lizzie Nkosi. She is Eswatini's health minister. Senator, good morning. Thanks very much for your time this morning on the AM report. In fact, we're speaking to you in response to an interview we did just a little earlier this morning with the Communist Party of Swaziland, with Kenneth Kunene, the General Secretary there. And he's accusing the kingdom of not taking the right measures to protect the people of Eswatini. And he cites as an example the Ingwala that was held, where attendance was compulsory, that was a super spreader event. In fact, 2 of your ministers, both having attended the Ingwala ceremony, having died of COVID-19 just earlier this month. What is your response to the Communist Party of Swaziland and these accusations they've made against the kingdom?
Good morning. I think it's really sad that people are using the pandemic for political relevance. What is accusing the kingdom of couldn't be further from the truth. Ingwala has never been compulsory. And this year, with the challenge of COVID, we had taken extra precautions to make sure that anybody and everybody going in there is actually tested. Luckily, with the antigen test, we could get results very, very quickly. I think it is unfortunate because the second wave that we are experiencing is a challenge across the world. There isn't a single country that is not affected by it. So how would you explain all of the deaths and high numbers everywhere else?
Lizzie, can I interject there and ask you this? Why have the Ingwala ceremony in the first place when the world is battling a second wave of infections with variants that spread much more easily than the first? Why go ahead with the ceremony?
What I can say to you, the ceremony has happened and it was properly socially distanced. We tested everybody. It gave us an opportunity to look at how best we can organize testing very quickly, very efficiently, and have it controlled. Ingwala is a ceremony that happens every year. It's a ceremony that is sacred to the nation. So it has happened. But it wasn't Ingwala that it contributed, but it wasn't Ingwala that was the cause of this surge. The surge started very, very early in December, as you would know, and it continues long after Ingwala is gone. The surge is going higher and higher after Ingwala is gone. So I really would like to talk a lot more about what the country is doing about that. You know, we have increased testing sites, we have increased our response. We are working very, very closely with WHO and other international organizations to make sure that we are documenting and reporting appropriately for all the COVID issues that are coming up to us. We are reporting correctly with our numbers, and we're reporting only those that have tested positive. There's a lot of accusations around the numbers we report, the numbers of deaths. Of course, we have higher deaths this time. The first wave was preceded by 3 lockdown steps that we'd taken. Those were well timed, they were orchestrated properly, so that was better controlled. This second wave finds us after all those guards have been put down. It finds us in the middle of a nation that is just waiting to get out, waiting to be free, waiting to get out of their homes. And the messages, even though we have regulations that are very clear on level 3, but people were a little tired. So we have a very, very high second wave. You know, this is a reality, and we're dealing with that the best we can.
Lizzie, how
and we're doing a lot more.
Sorry, if I may interject there. Lizzie, how has the health sector responded, and how is it managing, in the midst of a second wave of infections? Have there been protests in the country? Have they asked for additional help, additional resources, and has government responded?
Yes, yes, and the second wave has hit us very hard. And that meant that everything we're doing, we needed to scale up. You need to scale up on human resources. You need to scale up on the response centers. You need to scale up and ensuring that you have everything in place, hospital beds and all that. We have challenges. We have challenges with the critical care spaces that we have. We have challenges with finding enough human resource, because we are going out there, government is giving us permission, throwing money at the Ministry of Health to do these things. And it is access to that, finding enough people to be responding continuously. We've scaled up testing. We've scaled up initiation spaces. We've even created kiosks where people who are positive can come in, be assessed for other comorbidities, and start their treatments and go home. We've scaled up in many different levels. We've had protest yesterday in one of the response centers where nurses were looking at, because they didn't discuss it with us prior to this protest, prior to the sit-in they were doing yesterday, they are looking for us to move the center to somewhere else. They are looking to get more nurses on the ground, but that is no reason for dereliction of duty. And that is where I come from. It's no reason for dereliction of duty. They have a hypocritical oath that says, first do no harm. While we are looking at getting more people into working, with more staff into these response places, we do have challenges. We have challenges, for instance, with the supply of oxygen. If you're looking from the beginning of December to where we are now, we've more than quadrupled the generation of oxygen in country. We've more than doubled the import. But as we increase, so do the numbers of people needing those services. What we're learning about the pandemic just now is that we are absolutely certain that we do have the new variant because it is more aggressive, it progresses very, very quickly, and unfortunately, a lot more people are staying at home much longer and not seeking help early enough. A lot more people are staying at home, trying other home remedies, thinking they're just treating a cold because it presents in so many different ways. So those are the challenges, those are the risk communication that we need to continue doing with the nation, that as soon as you suspect something, come and seek help, even if you're going to be treated at home. But initiating treatment early, we know that it helps a lot for people to recover.
Senator Lizzie
Nkosi, we have.
I'm going to interject once again. Apologies for that. That is unfortunately all of the time that we have for this discussion. Senator Lizzie Nkosi is the Eswatini Health Minister.